Greetings from myself. My name is Dr. Deodatta Chafekar. I work as a nephrologist or a kidney specialist in the city of Nasik since the last 25 years. Today, I would like to talk to you regarding the rising epidemic of high blood pressure all over the world as well as in India. And I would also like to tell you how to tackle this issue. High blood pressure or hypertension, also known as the silent killer, has become a global crisis. It is one of the leading causes of premature death worldwide. Hypertension has been labeled as the largest epidemic ever known to mankind, owing to its growing burden across the world, leading to over 10 million deaths every year. Now, of the estimated 1.13 billion people who have hypertension, fewer than 1 in 5 have it under control. So, it's very difficult to control hypertension in a majority of population who suffers from it. Now let's look at the Indian statistics, and you will be knowing that the Indian statistics are also equally disturbing. India is witnessing an escalating incidence of hypertension mediated diseases, which is creating a burdensome impact on the health of all Indians. Now the recent estimates from a study revealed that approximately 25% of the Indian population suffers from hypertension or high blood pressure. Now, in the elderly population, which is more than 70 years old or more, the incidence of hypertension is nearly 60%. It is also alarming that approximately 1/5 of this study population had high blood pressure and were not taking any antihypertensive treatment prior to the study. Among those who were taking an antihypertensive treatment, over 2/3 of the individuals had uncontrolled blood pressure. High blood pressure is also responsible for almost 8% of the total disability adjusted life years and is one of the major contributors to the cardiovascular diseases. As an estimate, in India, about 16% of ischemic heart disease or cardiovascular disease, 21% of peripheral vascular disease, and 24% of acute myocardial infarctions or heart attacks, and 29% of cerebrovascular or brain strokes are attributed to hypertension. Now let us discuss the risk factors for hypertension and what is their impact on overall health. High prevalence of hypertension coupled with low awareness and very poor treatment levels, it leads to high levels of uncontrolled blood pressure in the community. High blood pressure often occurs on its own, especially when there is a family history. However, several factors contribute to the rising prevalence of high blood pressure. For example, growing population, progressive aging, unhealthy diet, harmful use of alcohol and tobacco, overweight and obesity, lack of physical activity, exposure to persistent stress, diabetes, and high cholesterol levels in the community. What is the impact of rising blood burden of hypertension? India stands to benefit immensely if it seizes every moment to disarm the onset and progression of hypertension mediated cardiovascular diseases. And hence, all of us should stand together and united to make great efforts to control this rising menace of hypertension, and to increase awareness in the population, to increase the number of people who are under correct treatment, and also to find out what is the level of understanding among the public regarding the compliance of treatment as far as hypertension is concerned, and this is going to go a long way in ensuring good health of the general population. Today, I am going to give you some information regarding salt and hypertension. There are a lot of misconceptions about use of salt, which is sodium chloride, in the diet, and many patients, they have lots of questions regarding the same. I think it's a good idea to revisit this topic of consumption of salt because it is related to high blood pressure, and we should know what is the current thinking about salt and hypertension. Now, Indians consume almost double the recommended intake of salt as evident from a study conducted by the Public Health Foundation of India. The study found an average salt consumption of 10 to 11 grams per day in India, which is more than 5 times the physiological need, that is 2 grams per day, and more than double of the WHO recommended upper intake limit of 5 grams per day. This predisposes Indians to a high risk of developing various cardiovascular disorders, including hypertension or high blood pressure. And all of us know that there is a very close relationship between sodium or salt and high blood pressure. Now, how are salt and hypertension related? The effect of salt intake on the blood pressure is termed as salt sensitivity or salt resistance. Owing to its high sodium content, the table salt on intake expands the extracellular fluid volume and increases the cardiac output. This further initiates a cascade of physiological changes to compensate for increase in blood pressure. However, in salt sensitivity, these compensatory mechanisms are impaired and the blood pressure rises. A high sodium intake also stresses the kidney by excreting more water and less toxic waste. So what is the relationship between Indian diet and salt? As Indians, we cannot do without a serving of spicy pickle, chutney and papad on the food plate. Different kinds of chutneys and pickles are innate to different states of India. Though these recipes are associated with several health benefits also, the high amount of salt used for preparation and seasoning of these diet accompaniments is a matter of concern. Indian snacks like namkeens, sev, matri, chips, khakra, chaklis, etc. also contain high amounts of salt. But a common question which is asked is salt being used since ages? For millions of years in the history, the human diet used to be devoid of additional salt with natural foods as the only source of sodium. Later, with the purpose of preserving the food, the addition of salt comes into practice. Rock salt, pink salt and black salt were native to India. However, the gradual shift from these native forms to the modern refined table salt has added to an unhealthy factor to the diet. The refined table salt is stripped of all the minerals and it is undernutritious, with the only benefit of iodine that is added during its processing. So does reducing the salt intake actually improve high blood pressure? There is ample evidence, including landmark DASH, which was Dietary Approaches to Stop Hypertension study, to demonstrate the reduction of blood pressure on decreasing the salt intake. In the DASH sodium study, the impact of sodium intake at 3 different levels was evaluated in 412 participants with or without high blood pressure. The study was carried out on the background of a controlled diet and a DASH diet rich in fruits, vegetables and low-fat dairy products. It was observed that when the participants were shifted from high sodium diet to a low sodium diet or from a normal sodium diet to a low sodium diet, the blood pressure significantly decreased in individuals on either of 2 diets, that is, the control and the DASH diet. Another meta-analysis study carried out by He and McGregor demonstrated that modest restriction in salt intake for a duration of 4 weeks or more significantly impacts the blood pressure in both normotensive as well as hypertensive individuals. This study predicted that a decline of salt intake by 100 millimoles per day can reduce the blood pressure by 7 to 3 millimeters of mercury in patients with hypertension and 3 to 2 millimeters of mercury in individuals with normal blood pressure. In a nutshell, savoring the delicacies is not a problem while we keep moderation as the key. Some dietary changes can help in significantly lowering down your sodium intake. What are they? First, opting for fresh fruits and vegetables instead of packaged and processed snacks and meals. Second, selecting unsalted nuts or seeds, beans, peas and lentils, etc. etc. Third, avoiding adding table salt and canned salted vegetables to homemade dishes. Fourth, choosing low sodium salt options. Fifth, using spices and herbs to enhance the natural flavor of food. And last, choosing low sodium food. Considering the health benefits to delay or prevent the incidence of hypertension in normotensive people, as well as the positive impact on blood pressure in hypertensive people, the efforts to restrict the salt intake is worthwhile and we should strive to achieve it. So, it is my endeavor to educate all of you and to say that reduce salt intake in your diet for the simple reason that it is going to be of great health benefit. Try to see that you don't use processed and preserved foods. Don't add table salt to your normal cooked diet, as well as be conscious about the health hazards of high salt diet. Thank you for your attention.